so let's jump into this first panel. This is one that I'm genuinely excited about. The topic of men's full life fitness is not something that is commonly discussed. In fact, some people here in the audience probably didn't know the term full life fitness and what that meant before looking at the title of this. But before we jump in, I want to just quickly introduce our panelists today. So we have City Council President Blaine Griffin here with us today. Can you give him a round of applause, please? All right, and then I have Dr. Roderick Curtis, no, I'm not skipping over you, who's the Health Commissioner for Cuyahoga County, and also brings deep experience in populational health and environmental justice. So please give him a round of applause. And then finally, last but not least, Dr. David Margolius, who's Cleveland's Director of Public Health. He's also a physician and public health expert. And Dr. Margolius is leading bold initiatives within the city of Cleveland to make prevention and wellness more accessible to everybody in our city. So let's please give him one more round of applause. All right, so we'll jump in with this. So I'll start with you, City Council President. Why is men's overall wellness important to the city of Cleveland and surrounding areas?
Well, Dr. Vince, first of all, let me congratulate you for throwing an excellent summit. I remember when I first met you with one of my good friends, Dr. Barksdale, and to see this come to fruition is truly a proud moment. And I would tell you that I govern from a standpoint of health and full and whole health. And the reason that that's important is because a lot of times people don't understand in areas that like I serve, the Woodland Hills community has the lowest life expectancy in all of Cuyahoga County. So it's imperative that I govern from a standpoint of looking at everything from a lens of health, because we're in a position where we have too many disparities. And it's like that in too many different communities. If you look at the city of Cleveland, there's almost a crescent shape. And all of the areas where you have that crescent shape are areas that dealt with redlining, dealt with the lead crisis, deal with violence. And if you look at the epidemiology, all of the factors that we're talking about are dealt with government-constructed issues. That is why we passed racism as a public health crisis, because the CDC says when you declare something as a crisis, you have to do something about it.
Yes, sir. Yes, sir. Powerful. All right, so next I'll go to you, Dr. Margolius. Can you share a few of the most pressing health issues currently that you see within the city of Cleveland?
Sure, yeah, and I think Dr. Vince, you did a great job outlining it. Peter Lawson-Jones did, and Council President. So it all comes down to life expectancy in the city of Cleveland and our neighborhoods, which you heard about the life expectancy between men and women nationally. It's even worse in Cleveland, and it's worse in some of our hardest hit neighborhoods by historical racism and redlining to present day policies that are making it harder for Black people, especially Black men in our neighborhoods, to build wealth. Through home ownership, through home improvement. And so some of the pressing issues are cancer, heart disease. That's what takes lives away. Drug overdoses are most often men. And underlying both of those issues is social isolation, loneliness, and stress, which are extremely high in our community in Cleveland, and especially in men.
Yeah, I'm so glad both of you touched on this, because I always tell people poverty is an overarching issue, right? So it impacts so many different parts of our overall lives. And then the stress part that you mentioned, just living in poverty alone, we know causes you to live with chronic stress, which causes a lot of medical conditions. And so that just shows how these things all intersect, right? All right, so next I'll go to Dr. Harris. With your expertise in public health and environmental justice, what connections do you see between environmental and social factors in the men's health here in Cuyahoga County?
So what you've already heard is that your zip code can predict your life expectancy, right? But what does that zip code really mean? A lot of times it's your environmental exposures, exposures to risk, exposures to hazards. And in some of these communities, you will have, if you think about social and environmental, what I want to do is focus on what's positive, right? That can lead to longer lives. So less crime rates in your community, healthier parks or safer work environments. You also have healthier homes, healthier schools, healthier child care facilities. You can think about it from the perspective of air quality, whether that's indoor or outdoor air quality, and how close you are to toxic environments and industries. So I think if you think about what they have in those communities that are living longer lives, and in Cuyahoga County, we see that there's a 20-year gap in some communities that are closest 2 or 3 miles to one another. And so if you think about that gap and what those communities that are living longer on average have, a lot of times it's environmental exposures. But I think the question we really need to ask ourselves is, why do those communities have what they have and others do not? So.
Absolutely. All right, back to you, Council President. What policies and legislative efforts should people in attendance and local leaders be aware of that are currently being enacted or worked on to improve the health of our community?
Well, you know, the best thing about being a council person is that you don't have to be an expert about everything, but you have to know a little bit about everything. So what I would tell you is, you know, right now we have several policies. One of the policies that I'm most proud of are policies that catch some of these issues upstream.
Yeah.
Things like lead safe certification, where we actually required rental people who are renting units to citizens in the city of Cleveland that have a lead safe certification. And Dr. Margolis's department is taking care of that now. Issues like anti-idling, so that we can limit pollution that's going on in air quality in our area. So those are some of the micro things. But I always tell everyone, when I mention that crescent in those areas, we have to govern from a standpoint of looking at everything from a public health crisis. Absolutely. I happen to believe that violence is a public health crisis. And we have to look at it as if we isolate, you know, identify what the host is, isolate it, and then inoculate the rest of the population. And those are the kind of ways that we try to govern from a holistic standpoint with all of the legislation that we write and all of the policies that we implement.
Absolutely. All right, Dr. Harris, are there specific initiatives you've seen that have been implemented to help successfully deliver healthcare access?
I like that you mentioned violence, because I think that's one of the things that is really going well sometimes in certain areas of Cleveland. But like Cleveland Peacemakers deals with that a lot. They're a coalition of violence interrupters that go out there and kind of defuse beefs that might be existing in the community. But those grassroots workers that go out there and put their lives at risk to make sure that younger brothers and sisters are living longer is great. I think we should also think about some of the resources that we have. And 211 is a United Way call for help. Many people don't even know that 211 exists, but there's a number that you can call to find any resource that you might need in the community, whether that's a mom that needs diapers or a man that might need a primary care provider and need to know where the federally qualified community health clinics are. I mean, there's a place that you can call that can connect you to resources in your community. I'm also thinking about premature death, especially around men and opioid overdoses, and Narcan outreach. There are Narcan vending machines that Metro Health is putting out in the community. We have the centers, which is another federally qualified health center. They have a mobile unit that goes out to certain areas. I won't say which communities they are, but certain areas where people are using drugs and they can get this Narcan, and they can also get syringe exchanges and all those services provided, while also understanding that this is a clinic that they can go to for primary care services. I can go on and on. I don't know how long I have, but there's a lot of programs that are going on in our community that people don't know about. And we need to also do a better job of connecting these services to young people, getting on social media, meeting those individuals where they are. I would also say that Northeast Ohio Black Health Coalition is a great partner. I don't know if you all know Ivanka Hall, but she's a powerhouse, and we have some great grants that we're working on with her and have in the past. But she has a car show. So she get men out there, they have their cars, she's worked with the car clubs, and they come out there, but while they're also there, they're getting connected to services, they're getting screenings, et cetera. So there are things like that where people can have fun, build connections, build rapport. It can be intergenerational, and can really support.
Yeah. All right, Dr. Margolis, I'll come to you. I know you already implemented a lot of innovative strategies in your time at your current position, but are there any other innovative approaches that are coming down the pipes that we should know about?
Yeah, well, I'm going to give Council President some credit here. So, when we talk about redlining, when we talk about structural racism, the way we see that now is that homes in red line neighborhoods have not been invested in. You know, just money has not gone into red line neighborhoods historically. There is a racial wealth gap in the United States and in Cleveland, where every 12 cents or every $1 white family has, a black family has 12 cents. And so to reverse that, we have to be intentional about investing money in red line communities. And so Council President, as being, you know, the head of City Council, has steered investment into building the Myers grocery store in Ward 6 in the Buckeye neighborhood. He has helped to shepherd through the Woodhill homes. So, you know, I grew up in Shaker Heights right across the border in Cleveland. And so I used to drive going downtown, Larchmere, and then you hit Woodland, and you saw the CMHA Old Woodhills homes, and just the contrast from going from Shaker to a red line neighborhood, these particular housing projects, it was not good. And so to now see what is being built there, for people to be able to live with just in a beautiful place, the opportunity to gain wealth, the opportunity to live in a housing that has no lead, right? There is no lead, and there is beautiful. So all of that policy, all of those investments that are happening into formerly red line communities, I mean, that is how we get out of this.
Absolutely.
Dr. Vince, I approve this message.
All right. So, Dr. Harris, I'm going to come back to you. If there were one thing you could change to positively impact men's wellness, what would that be and why?
So when I think about the full life wellness, I think about things that are the social determinants. That's what we deal with in public health all the time. What are the social determinants of health? And you can't really have a healthy man if he doesn't have a healthy job or even have a job or even have financial stability, right? So how do we make sure that we have an opportunity to address some of those basic needs that men might have? I always say, when I go out and I do lectures, I talk about policies and how that can influence this. And I give this example of people that I see every day, my relatives, my friends, my neighbors, whatnot, about, you know, it could be a young man who has gone and committed a violent felony or a drug felony, but then that spirals into all these other things. So even if he does his time, he comes back out, he can't necessarily get a job, especially a job with healthcare benefits, right? He can't necessarily get financial aid to go to school, so then he can get a better job. He can't get HUD housing if he needs Section 8 or something like that in order to find a place to live. But yet he needs to pay his restitution, he needs to pay his child support, all these other things. And if he doesn't do that, then he goes back to jail. So then people make these difficult decisions that they need to make. And I think sometimes we don't connect those dots and think about how it's more than just primary health care or finding a physician. It's how do we wrap our arms around these men to make sure that they have their basic needs met.
Absolutely. Council Presidents, what are your thoughts?
Well, I mean, he summed it up pretty much. But, you know, one of the things that I will tell you is that, and my friend and mentor, Peter Lawson Jones, is one of the guys that did it, is really just providing wraparound support and holistic support for fathers. When you have 66% of our community that are single parent households headed by women, female single parent heads of households, it's imperative that we try to have healthy relationships and try to have holistic men. And some of the stories you told me, I think were just phenomenal. I think mental health, I know we're going to hear from one of my former assistant pastors, Cal Early, to talk about mental health and also meeting men and where they're at.
Yes, sir.
At the barbershops, at the clubs. I apologize. We may not always get the crowd that we might try to target at 8 o'clock on a Saturday morning.
That's true.
Sometimes we got to go to the spot at 11 o'clock at night because that's where the actual action is at. And, you know, people like Waverly Willis and others that are doing things in the barbershop where men have a comfort zone because we still have some apprehension to really embracing that holistic approach that these two gentlemen are talking about. Right?
Yeah, absolutely. Dr. Margolis, your thoughts?
Yeah, I mean, I think that is everything that's been said. I would say, you know, just focusing on lead poisoning that Council President brought up earlier, we have so many layers of lead paint in the city of Cleveland. And so what if we train an entire workforce to work on, you know, getting the lead paint out? And we're doing that. So City Council's invested $10 million into the Built Environment Collaborative that is offering free training, certifications for future contractors. So if you just go to builtenvironmentcollaborative.org, it's run by Greater Cleveland Works. and we're bringing up the next generation of workers. And the reason that's important is because, we started out talking about how isolation, loneliness, stress is so high, the lack of community, the lack of the opportunity to be out talking about health with other men, with other people. And so getting folks outside doing this type of work is the way to build wealth. It's the way to end loneliness and build community.
Absolutely. All right, Council President, what are some ways that you think government leaders and healthcare leaders can come together to make a positive impact in our community?
Well, I mean, when I first became council person, I had the good fortune of meeting with Dr. Mihaljevic, and Dr. Jarian is also in the ward. So I have the good benefit of being able to work with some phenomenal leaders, Statinists. So one of the things I did is I actually took them out and said, let's walk the neighborhood. Let's actually get outside of the clinic walls and we walk the neighborhood. And we talk to the kids in the park. We talk to the residents. We talk to the legacy residents that were in the neighborhood to get them outside their walls. And as I was walking with him, I said, here's what they need to see. I said, we need to have a partnership in making sure that we take advantage of what you have, which is healthcare. We also, you do that best. We want to make sure we have access to good healthcare. We need access to the best research. So we put several research facilities over there where actually our folks are able to take advantage of brain studies and other things, which these are free studies that actually you almost get like corporate physical for joining these kind of studies. And then I said, responsible, development so that we don't have displacement, but also really trying to tap into the workforce and making them a partner and feeling like we're partnership that's holistic and not just transactional.
Absolutely.
And that's where you can build that kind of trust. Throughout the years, I think healthcare agencies haven't done a good enough job, and the healthcare industry has not done a good enough job of building trust and really helping to make sure that people are seen as partners and as patients, not just transactions.
Amen. Amen. Okay, so last question, and then we'll wrap things up. I'll start with you, Dr. Harris, and then we'll just come back to the Council President. So in 10 words or less, what key message or lesson would you want our attendees of today to take away with them?
I would say you are in more control over your destiny than you probably realize. So 10 words or less. Make choices today that your future self will appreciate. I think that's something that I would still agree.
Dr. McCullis?
I would say get out of your house, talk to your neighbors, build community.
Absolutely. Council President?
One thing we didn't mention is dentistry. I know I have my brother, Dr. Malcolm Waters here. My father died at 60 years old. Most men do not get their teeth checked, and it could lead to some health disparities too. But what I will say, if I was to leave 10 words, is that look at everything from a lens of health. Health is wealth.
Absolutely. All right, so if we could give our panelists one more round of applause. So from this conversation, I think we gain an understanding that what we're talking about full life fitness goes way beyond a physical checkup, right? And so nobody asked me, but if I had to say 10 words or less, my word would be empowerment, right? So we want you to leave here today feeling empowered, gaining some education, gaining some knowledge about the resources that are available to you. We want to truly build community and partnerships. You're not alone, so leave empowered. And with that, we'll segue to the next section. Thank you again, guys. We appreciate it.